In this chapter, I will be discussing the major steps to a typical surrogacy journey. Now, of course, every journey is unique, but every journey is similar in terms of where to start, what needs to be done before the surrogate gets pregnant, and the legal processes for the baby to officially become the intended parents. So, before any journey begins, we start with step 1, creating embryos. Now, I realize that some of you probably already have a lot of experience with IVF, so you probably think that this discussion is not worth your time. And while that might be true, I wanted to let you guys know that I'm going to be talking about PGT, and I don't know if you've had that experience before, as it's relatively new. So I'll be talking about PGT in the context of surrogacy and how it may be more relevant than your typical IVF process. Now, for those of you that have never done IVF, my discussion here is abstract. I can't go into incredible detail because IVF is going to be tailored to whatever you need. But what I present today is a basic overview and should cover a lot of what your experience will look like. So every surrogacy journey begins with an embryo. And before we start a surrogacy journey, we have to create embryos. And embryos essentially result when an egg becomes fertilized by a sperm. And in gestational surrogacy, embryos are created either by the intended parents, so the egg of the intended mother, or by donors. So whether there might be an egg problem, there might be a sperm problem, or there might be a problem with both. Or if you're a male same-sex couple, neither of you guys have eggs, so you need to get an egg from a donor. But no matter what, it's always an embryo, which is the culmination of an egg and a sperm, into the uterus of a surrogate. And no matter which method, so no matter if it's the intended mother going through IVF or if it's a donor, both of these parties have to go through in vitro fertilization, IVF. So in vitro means in glass, fertilization. So IVF covers that. And essentially what happens in IVF is that mature eggs are collected from the woman's ovaries and they are fertilized with sperm in the lab. And if you go through all this process and you have embryos left over, because we'll talk about that not all of these eggs will become fertilized and become embryos. Generally one, and less commonly these days 2, embryos will be eventually transferred to the surrogate's uterus. So the most costly and timely part of IVF is the egg retrieval. So it's the process of gathering the eggs from the woman's ovaries. And this procedure must not only be done according to the woman's menstrual cycle, but also according to what the clinic has available as they're scheduling all their patients. So generally an IVF cycle to gather the eggs will take about 1 to 2 months. Now to get these eggs, the doctors have to prescribe a series of medications, and they're usually in the form of subcutaneous shots. And these are shots that are very tiny, they're not very big, and they are injected around the tummy area. And the goal of these shots is to stimulate ovaries to produce as many mature eggs as possible. And the duration of the stimulation phase, this phase of shots, is usually between 8 to 14 days. And during these 8 to 14 days, the patient, the woman getting her eggs retrieved, should expect to go to the fertility clinic every other day, and towards the end, every day, so that they can monitor the size of her follicles. Now, the follicles are in the ovaries, and the follicles is what produces these eggs. So during this stimulation phase, as the woman is going in every day, the fertility doctor is also looking at her ultrasound every day, and the ultrasound is what's used to look at the follicle size. And one day, the fertility doctor is going to take a look and determine that, aha, today's the day where the follicles look great. We're going to go in and we're going to retrieve the eggs. And that day, the woman takes a trigger shot, which is a major, now this shot is pretty major. It's intramuscular, so it's going to go in her backside about 1.5 inches. It actually doesn't hurt that bad either. And 36 hours later, she's going to go in for her egg retrieval procedure. Now, the egg retrieval procedure is a short 15 to 30 minute process. It's not even a surgery. It's no big deal. And basically what happens is that an ultrasound guided needle will go in and gently remove the eggs from the ovaries. And generally, these patients are sedated, they're put to sleep, but it's a very light sleep, and they experience very little to no pain afterwards. Maybe a little bit of mild cramping, but ultimately the patients go home the same day. It's not a big procedure. Now, sometimes a patient can get ovarian hyperstimulation syndrome, and that happens about 1% of the time. And this will generally happen after the egg retrieval process, but that is relatively rare in terms of outcomes from this procedure. So after the egg retrieval, the eggs are retrieved, and the number of eggs retrieved really depends on many different things. The major driving factor that determines the number of eggs retrieved will be the woman's age. So the older the woman, the fewer eggs. So on average, there are about 8 to 14 eggs that are retrieved from an IVF cycle, and this involves women from their 30s until they're 45. So that's a huge range, and you can get more precise numbers according to your age in many sources. But let's just say it's between 8 to 14. The issue is that although that seems like a lot of eggs, many of these eggs will not be of good quality. And unfortunately, as women get older, the quality of their eggs decreases significantly. And as you go from egg to embryo, you're going to notice an alarming amount of attrition. So you could start off with 20 eggs, and at the end of the day, at the end of 5 days, you would only be left with 1 blastocyst. Now, this happens a lot. You have women that get 40 eggs, and after 5 days, there's only 2 or 3 blastocysts, which are 5-day-old embryos that are remaining. So prepare yourself, if you don't know anything about IVF, of this tremendous attrition rate. So a typical example that you will see from egg to embryo is something like this. There will be 10 eggs retrieved from the woman during the egg retrieval procedure. 8 of them will be mature eggs, so an egg needs to be mature in order for it to become fertilized. Now, 6 out of the 8 mature eggs will be successfully fertilized with sperm to become an embryo. And then what the IVF lab is going to do is they're going to leave these embryos in their petri dish for a few days. And the idea is that whichever embryo remains after a few days in this petri dish represents a very strong embryo, or an embryo that is more likely to survive in utero versus the ones that could not. So in keeping with our example, 5 of the 6 embryos survive to day 3, and then 2 of those make it to blastocyst, which is a day 5 embryo. And about 50% of day 3 embryos make it to day 5. So the part of the process where you see the most attrition is from day 3 embryo to day 5 embryo. So it's because of this attrition process that many people go through multiple rounds of IVF. Now, if you are a woman older than 35, you should plan at least 2 IVF cycles in your journey. And many people, even under the age of 35, will need more than 2 IVF cycles to get a good embryo. 1 cycle of IVF isn't that expensive, but what makes IVF really expensive is the fact that you're going to need probably multiple rounds. And you can imagine that after doing this 2, 3, or 10 times, that the price of IVF is ridiculous. So without insurance, 1 cycle of IVF is somewhere between $12,000 and $17,000. And this is not including medication. If you're going to include medication in that price, then on average, you would add an additional $4,000. And since we're talking about the cost of IVF, one thing to consider is the cost of pre-implantation genetic testing, otherwise known as PGT. So this is a relatively new technology where the IVF lab will take a biopsy of your day 5 embryo and send it out to a lab. And then this lab will do some sort of test on it to make sure that the embryo has the right number of chromosomes. And basically, they're answering the question, does the embryo have 23 pairs of chromosomes, one set from the intended father and one set from the mother? The reason why this is important to consider is that abnormal embryos, so embryos with the wrong number of chromosomes, is the leading cause of miscarriage. And since you're dealing with a surrogate and implanting the embryo into a surrogate, there's already a lot of cost involved in getting to that point. You want to consider putting your best embryo forward. So identifying and trying to select an embryo that has a less risk of chromosomal abnormalities. PGD testing is very controversial. It's not straightforward. I'm going to save that discussion for another day, but it's something to consider. And if you are going to do it, it is pricey. So on average, there's a $350 shipping fixed cost. And then after that, it's $250 to biopsy each blastocyst that you have, day 5 embryo that you have. Now, this is the cost from my clinic. And from what I know, that price varies widely across all types of clinics. So you definitely want to ask your clinic how much it costs to do PGT. However, unfortunately, it's important to keep in mind that it's very likely that most of your embryos will come back abnormal. So they've gotten all the way to day 5 embryos. They've gone through all that attrition process, and you have this, glorious bundle. And then from this bundle, you have to ship them off and see how many come back normal. And unfortunately, most of the time, it's going to be 1 or 2. So IVF is hard. IVF is hard for many reasons, mentally, physically. And for me, it was definitely this mental component of IVF that was the most challenging. So keep in mind that at age 35, approximately 50% of your blastocysts will come back abnormal. Every year that you get older, or the mother gets older, that number just increases significantly. And so for my case, I was 34 years old when I did IVF, and that number for me was closer to 60% or 65% of my blastocysts came back abnormal. But again, since we were dealing with a surrogate, we thought that it would be in our best interest to pick an embryo that would have the highest chance of succeeding. So the last thing that I wanted to talk about today was the use of donor embryos, eggs, and sperm. So intended parents may need, or they may wish, to use donated embryos, eggs, or sperm in surrogacy. And so in this case, IVF may not be required. So if you're going to use donated embryos, you should estimate a $10,000 cost. So this will include the agency fee, so the agency that is finding the donated embryo for you, the legal fees, and the frozen embryo transfer to the surrogate. On the other hand, if you want to use donated eggs, so whether or not it's you or your partner that's going to fertilize your sperm into the donated egg, this costs $25,000, primarily because using a donated egg requires the donor to go through an IVF cycle, and the donor is not going to pay for that. You're going to pay for that, paying the donor for her egg and the legal fees associated with donated eggs. So you might be wondering, well, why is using donated eggs so much more expensive than donated embryos? And this is because we have an oversupply of embryos out there that people aren't using. So many people have gone through IVF, they have created these embryos, and they have too many of them, and they don't wish to have children from these embryos. So we have an oversupply. And so many people are just donating these embryos to people who are in need. So this is why it's $10,000 versus with a donated egg, the donor has to go through an IVF cycle, and an IVF cycle, as we discussed, is pricey. And then finally, the cheapest option we have is donated sperm, which on average costs about $1,500. It's easy to get.